Welcome to our session on using NPIN's website collaboration group to support information sharing and foster STD program improvement. We're really excited about today's call. The NPIN website is really a great tool to really help create a virtual community where we can share information among each other. And so we're going to spend the next hour sort of talking about why we think the site is helpful. We're going to have somebody talk about sort of all the ins and outs and some strategies for using the site, and then have a couple of case studies on how some people have used the site and made it very useful to them. So without further ado, we'll go ahead and get started. First, a couple of housekeeping things. Everybody is in listen-only mode. If you do have any questions, you'll be able to use the chat function, which is on the left-hand side of the screen, and send them in. We will be taking questions, and usually in between speakers, we'll take at least 3 or 4 minutes of questions, and then we'll have plenty of time at the end to do questions. And if we need to, the call can run over past 2 o'clock to make sure that all our questions all your questions are answered. So this call is being recorded because one of the things we do after the call is we will post both the recording and the slides on the NPIN website, so that people that can't, who missed the call, can access it, as well as if people miss something or want to hear something again, they can see it. So we will have recordings posted on this. Again, if you have a comment or a question, enter it into the chat function, and we'll make sure we cover everybody's questions. So one of the things we'd like to do is always do a couple of poll questions throughout our session to really kind of, first of all, find out our audience. So if everybody could take a minute and indicate, where do you primarily work? Is it a local health department, state health department, CDC, non-governmental organization, et cetera? So just click on the bubble, and we'll see what the poll tells us. So, I mean, this is really promising. Over 60% of our audience right now is from either a state health department. We don't have anybody from a local health department. About 30% of people are from CDC, and a few people from non-governmental organizations. So again, one of the purposes of our NCSD's It's Your Call discussions is really to have, not only present information, but have a chance for our STD prevention colleagues across the country to sort of dialogue with each other around key issues. So we're glad everybody's here and from a diverse audience. A little bit about our agenda. For the first 10 minutes, we're going to do a quick discussion. I'm going to just kind of give you an overview, and then I'm going to turn it over to Cynthia Newcomer, who's going to talk about really how to use the site, some strategies, how do you get around, navigate, sign up, those kinds of things. Followed by a couple of case studies from a colleague, Diana Gardner from Idaho, and Tom Peterman at Centers for Disease Control, of how they've used the site. And then we'll open it up for questions and discussion. This is a really great opportunity. We really want to hear from you, especially those of you who have used the NPIN site. We want to know, is it meeting your needs? How can we improve it to really kind of fit as a great tool for information sharing? So just to get an idea of how many people have used the site so far, if you could just indicate yes or no if you have already accessed the site as of today. So as you can see, about 70% of you have already used the site. And, first of all, we really appreciate all of you who have already used the site for being on this webinar, because, we think a lot of people have used the site, but maybe aren't familiar with some of the ins and outs of strategies and how to effectively use the site, and some tips and tricks that we think will make it even better. And then we also want to sort of talk about, how do we really make this a valuable tool for all of us in kind of creating a community. So And for the 30% of you who haven't used the site, we're hoping that this is kind of, whet your appetite, kind of demonstrate how valuable this tool is. And then hopefully at the end of the session, you'll quickly get on, log in, and then become a member and start using the site. So again, it's great to see that so many of you have already used the site, but what we really want to do is not only have people signed up for the site, but to really use it frequently. So thank you for those of you who have already done that. So to me, why I'm so excited about this site is, we just went around over the last 5 or 6 months and had a series of special interest group meetings for STD Apps grantees. And one of the, obviously lessons from these meetings was, they were great meetings because almost all the content was presented by STD programs, at the state and local level. And so we heard from peers, and what was really obvious is that almost every program, if every program, has really developed some interesting and useful tools and resources and promising practices that a lot of us could use in our jurisdictions. And none of us have enough time in our work, especially at the state and local level, where we're just inundated with so many things coming in, people asking us to do so many different things. And so when it comes to developing a new strategy, oftentimes we spend a lot of time developing stuff when somebody else has already done most of the work. And so what we're trying to do with this NPIN site is really create a virtual community in real time, so we don't have to wait every year or two for a conference or until we have SIG meetings to share it and exchange tools. We can be doing this every day. And it was amazing at these meetings to hear about all the exciting things that people are doing, as well as resources that they've created, whether it's spreadsheet tools, great media campaigns. And so I think it's obvious in this day and time we just don't have time to do everything ourselves, and why not learn from each other? And I think the other thing is sometimes we have a tendency to become siloed. Even on our own programs, we're talking to our own staff, but there are a lot of times different ways of doing things. And I think by reaching out to colleagues across the country, whether it's a jurisdiction that's similar to yours or a different kind of jurisdiction, we have so much to learn from each other. And the NPIN tool really is a great tool to really kind of promote, again, in real time, how we can share. So we've actually, NCSD has collaborated with the CDC Division of STD Prevention over the last 4 or 5 months to build 4 or 5 what we call STD private groups. And Cynthia later on is going to talk about sort of the difference between a public and a private group. But for STDs, we've actually created 5 groups. We've created a peer-to-peer technical assistance, which is really the general group where almost all the issues go, unless it's something very specific. So if you need, a tool on surveillance or a general surveillance, or you're doing you need some information on how to develop a training on, phone partner services, that would be the place where you could go. We also, each of the special interest group meetings, although we had some common themes, we had individual presentations, and the meetings were really tailored to the participants. So one of the things we have done, and we talked a little bit about this at the meetings, for the first 2 meetings we hadn't developed the site. By the time we got to the 4th and 5th meeting, the 3rd and 4th meeting in Albuquerque, we had developed some materials. But we have uploaded all the presentations from the SIG meetings, all the promising practices, as well as at a number of the meetings, people talked about tools they had, and when they did, we often said, hey, could you share that with us? And so if it was related to the SIG meetings, we posted that in the SIG meeting. We've created a group for one of the things that you're going to be hearing about more in the future is that there has been an increase over the last couple of years in female and congenital syphilis. And, the division is really working to sort of get a handle on this and see how we can, get out more information and resources to project areas that are having increases in female and congenital syphilis. So we have a group that sort of is specializing on that. And the nice thing about a private group like this is that when you go to that private group, all the content is sort of specialized. So all the conversations, if you only want to see conversations about female and congenital syphilis, you can go to that group. Another nice thing about the NPIN site is that you can also cross-post information. So I could put some information or a resource in the female and congenital syphilis group, but also post it in the TA group. So one of the things we're kind of learning is that if you post anything, it's oftentimes also helpful to post it in another group that might be related. And then the other thing that we've done is over the last 6 months, we've been working with the surveillance branch and surveillance and data management branch to create a couple of specific users groups for PRISM and MAVEN, which are STD information systems. And so I think those of you who have had experience in the past with users groups, it can be very helpful to get really technical people together to kind of talk about, whether it's strategies or whether it's code or how do I get the best data dictionary, those kinds of things. So we've been working with, again, that branch to make sure we have users groups. And so for each of the private groups, we have somebody from the STD, STD program at CDC as one of what we call a group administrator. And then Cynthia and I also are part of all the groups, so we can make sure that, content's in there and sort of be a resource to everybody. So I want to just now quickly give you an idea of some of the resources that have been posted, and then we're going to kind of back up and go into a little bit more detail about how do you get on the site, how to use the site. So this is kind of, I'm going to go through this very quickly, but just some examples of some great resources that have been posted over the last month or so. So, Donna in Alaska posted some really interesting information about extragenital screening and actually had from a bulletin some of the results and why it's so important to have not only urogenital testing, but extragenital testing for chlamydia and gonorrhea. Another good example is Terry Dawson from New Hampshire posted some resources for PRISM, which I think, especially, people are developing PRISM all over the spectrum. So some have already developed it, some are starting. And I think there's a lot of questions about how much does this cost? How can I get a hold of material so I don't have to recreate the wheel? So, Terry generously posted some cost information as well as actually uploaded a copy of their data dictionary or their training guide. So instead of somebody having to create their own training guide, you can just get a hold of New Hampshire, edit it, make some changes to your site, and then have something without having to spend all that time developing it. Another example is one of the things that I heard at the SIG meetings was that sometimes people, have some difficulty in identifying outbreaks, especially if you're only looking at statewide data. Sometimes it's very hard to see if you have an outbreak. So when I was the program director in Illinois, we had developed a fairly complicated spreadsheet, and we had 102 counties. And so we developed this algorithm for different size counties to be able to identify when they might be having an outbreak based on the 3-month, average change. So this is an example where we've created a spreadsheet. All somebody would have to do is go up to the site, download the spreadsheet, change their county names, look at the county populations, and then plug in their own data, and you have it really, you've saved yourself, it probably took us months to build and refine this tool. So another example of something why recreate the wheel. California's done some, they're having an outbreak of syphilis in females and congenital syphilis in several jurisdictions, and they've developed some great educational materials. So they generously posted those materials so that you can then, if you think you're having an outbreak and you need some materials, instead of starting from scratch, here's off-the-shelf materials that you can, probably, talk to California, get permission to revise them, and then just rebrand them to you, with again, acknowledgement to California. But, you can probably save yourself thousands of dollars in having to redevelop these materials. There's some really great materials from Arizona that they did from a comprehensive media campaign. So again, some good examples. Again, one of the things that I heard at the meetings was people were talking about how do I get training for my DAS, especially over the web, because I don't have enough resources to put together a class. So for example, I shared a training, and some other materials that we developed that had not only, how do you do face-to-face counseling, but how do you do, on the phone counseling, those kinds of things. So again, just a real quick example of some resources. So, one of the things, I often, we started these sites about 5 months ago, and we do have over 100 people signed up for the STD site. But in looking at some of the barriers, what do you think are each of these are sort of ranking, but if you could rank these, I think they're 1 to 5. What are your barriers to using the NPIN site? So just rank them. I think 1 is your biggest barrier, 6 is your least barrier. So I'll give everybody a minute to fill these out. So again, all you have to do is click on those down arrows, pick a number, and if not, we'll just move on for a second. So I'm not sure everybody can see the screen on this as far as the poll results. But I think, one of the things I've heard from people is, I'm so busy, I don't have time to get on. And I think one of the things we really need to change people's perception in the fact that, yes, it does take a little bit of time to get on. However, you can save so much time in developing resources by getting on there. And I think I think the time factor is a big thing. And I think if people just say, hey, look, if I just spend 5 minutes a week either posting something or responding to a question, you're sort of helping us to build this community. And we need people to participate. Otherwise, we won't have a community. We can't just have a couple people posting and then just people kind of looking at the stuff but never commenting or never posting. So it's kind of like we're all in this together and we can all really share a lot from each other. Another big thing I think sometimes is people are a little bit either shy or afraid of either posting something because they don't want to feel like they're bragging, or they're afraid of posting something because they don't want to look stupid, or if they have a question. And I think it's one of those things, don't worry about it, just do it. First of all, we can learn from each other. There are no stupid questions, and there's just so much good resources out there. Just take your time to do that. Occasionally we hear some people having some issues about logging on, and we can, Cynthia can address that. But again, just to get an idea, there are some barriers, but I think people just need to say, hey, I think this is worthwhile. I'm going to invest a small amount of my time, 5 or 10 minutes a week, 1 time a week, and I think we can really build a great community. So that's kind of a really quick introduction to the sort of why I think the NPIN site is useful. I'm going to turn it over to my colleague, Cynthia Newcomer, and she's going to sort of talk about how to use the site and some effective strategies. So Cynthia?
Good afternoon, everyone. Can you hear me okay?
Hear you great.
Okay. I want to start with a quick overview of NPIN because not all of you may be familiar with the project overall, and then I'll segue into the NPIN community. So NPIN is CDC's partner platform for prevention workers and HIV/AIDS, STD, viral hepatitis, and TB. We offer a number of resources on the npin.cdc.gov site. You might be familiar with the gettested.cdc.gov website, which used to be HIV Test. So the organization's database on NPIN actually powers the results of that site. That's one of the things that we're most known for. We provide a real communication infrastructure, the NPIN community. We do a lot of work on social media. Some of you may have participated in our regular Twitter chats. We also do webinars and telebriefings. We serve a diverse mix of partners, and we've recently redesigned the NPIN site so it's a lot more useful. We added the community, we added a training section, digital tools, improved the search. So we hope you'll check out the new site if you've used it before, and if you've never used it, I hope you'll appreciate what we have on the site for you. The NPIN program is managed by the National Center for HIV, Viral Hepatitis, STD, and TB Prevention, and its contractors, Danya International, who I work for, and JBS International. JBS is in charge of the technology, and Danya is responsible for the content. So moving along, The community is open to people actively working in HIV, STD, viral hepatitis, and TB prevention, and also students, graduate students who are working towards degrees and with a focus on those 4 disease areas. As Charlie mentioned, it's a space to exchange resources, to discuss prevention successes and challenges, and to collaborate. And we have a number of features in the community that help you do all of those things. You can see the public content on the website even if you're not a member, but if you're a member of a private group, that content will not show on the site. And you must be a member if you want to engage with the content. So if you want to post, if you want to comment, you have to join the community and be approved, and you have to be logged in order to do those things. So I mentioned private and public groups. So we think of the community as a house, has several rooms. So if you're approved into the community, you can enter the house and participate in some rooms. Rooms will have a facilitator. So the 4 public groups we have right now are HIV, viral hepatitis, STD, and TB. You can actually participate in any of those 4 public groups if you're interested. If you're posting something that relates to STDs and viral hepatitis, you can make your post go into both of those groups. So anyone can see the content in these public groups. The private groups that Charlie mentioned, here's 3 of the STD groups, only you who are members in those groups will be able to see and interact with that content. And you have to be placed in those groups. So Charlie and some of the other folks, Marvin and Yolanda, they will place you in the group once you've been approved into the overall community. Next, I want to show you a few of the features, and then we'll actually go on the site. So one of the networking features of the site is a member directory where you can actually search for people with specific expertise, people in specific locations. You can also search for people by name. So if you're dealing with a particular problem, you want to see who else in the community has expertise in that area, you can use the member directory. The conversation feature is really if you want to initiate a discussion with folks. If you're seeking particular information and you want to put a request out there, you would use the conversation feature. The resource exchange is where you would post some of the examples that Charlie showed earlier. If you have protocols, if you have spreadsheets that other people could use, if you have educational materials, you would use the resource exchange, and you can upload documents and you can also download them. We also have expert op-eds where you'll hear from subject matter experts. There are wikis where you can collaborate to create a common document, and those have to be initiated by the administrator of the group. And then there's a polling feature where the administrators can gather specific information from group members. So now I'm going to segue over to a brief demonstration of the site. And I know we're moving pretty quickly, so if there are questions, we'll get to those at the end. And then also if you have particular questions you want to ask of me, you'll be able to contact me, and Charlie has my contact information.
And people can also use the chat function to ask questions while you're talking, and then we'll get to them. So. Right.
Okay, great. So this is the sign-up page. It's pretty standard. You're used to signing up for sites. So one thing I wanted to quickly point out, we want you to be sure to include your STD affiliations in your bio, just so we know that you should probably be placed in some of the STD groups. This is where we ask people to fill in your expertise, and that will really round out your profile that people can use the member directory to access your expertise if they want to contact you. We also have a list of populations, so we'd like to hear which populations you have experience with, and then also the settings in which you work or have worked. So the more you can complete this, the better it's going to make the member directory in terms of people being able to network with each other. So once you register, I will read your information and approve you. Then you will be able to come into the site, and you will initially come in at a dashboard. It'll give you a snapshot of everything that's happening in your groups, so your areas of interest. It'll show you the activity that you've most recently had on the site. So if you can't quite remember if you posted something or not, you can go to your activity tab and you can see what you did. There's a direct message function if you want to contact someone. Say you look someone up in the member directory, you want to reach out to them, you can use that. And then the member search is where you access the member directory to search for people. So I want to go to the notification feature. Some of you who've used the site are probably familiar with getting email notices about new content in the groups that you belong to. So when you join a group or are placed in a group, you have the opportunity to follow that group. And when you follow a group, you're automatically signed up for email notifications whenever somebody puts new content into the site or comments on content. So you simply follow the group. You can also follow a particular piece of content. So if you wanted to follow this poll, for example, you could click the follow button. You can follow an individual if you want to keep track of what they're doing on the site. And then you can also follow a tag, which is the way that content is organized so it can be searchable on the site. So if you really want to hear about prevention challenges, then you could click that tag and it would show you everything on the site that relates to prevention challenges. If you want to manage your email notifications, which some of you may want to do, you go to your profile, click notification settings, and you can get a snapshot of everything you're following. I like to really read a lot apparently, so I'm following 91 pieces of content. And here's all the groups I follow. So if I decide I don't want to get the email notifications for the female and congenital syphilis group, I simply deselect send email. And you can always come back and select it again if you want to. And you can also, come into the community and look at the group to read what's been posted recently if you don't want to be notified. So basically, navigating around the site is pretty easy. You can use this drop-down. You can get to any group that you want to from the drop-down. And once you're in a group, you can see everything that's been posted. It's in categories, so it's really easy. Here's the conversations that have been posted in the STD group. Here are the resources, the op-eds, and wikis. There isn't a wiki right now, and polls. So that's really easy to surf around, and this gives you a list of everything without being categorized that's been posted recently. When you want to post something, you simply go to this section here. You start a new conversation. You share a resource, and you can add a link to your profile. You can search members. Some of these functions here are functions that I have that would not be available just to a regular member, so just ignore those. So when you're ready to post something, you would click Share a Resource. You'll put a title, and you want it to be, really concise and also very focused on what the post is about. You add some text. If you just have a link to a website, you use the link icon to link out to the resource. If you want to add a file, you choose the file from your computer. We have a list of the file types that are allowed. You push Upload. You can give the files a title, and then they'll be available for people to download, other members of the community. This section, Groups Audience, is where you decide where you want the resources to be published. The private groups are listed on the top, so if you belong to private groups, they'll be listed here. If you only want your information to go there, just be sure that you select just that private group. If you want to post to the public groups, anyone is able to do that. It's accessible to everyone. You can choose one, you can choose all four, and use the control button to select more than one. And we encourage you, if you're posting information into your private group, if it's something that could be of general interest to other people in the field and it's not information that you don't want shared more broadly, we encourage you to post it also in the public STDs section because we are trying to serve a broader community, and we really want there to be useful resources. So we encourage you to think about sharing more broadly if that's something you're able to do. I mentioned the tagging system. That's where we're categorizing information, as I mentioned. So really think about the common terminology used in your field when you're submitting a document so that you can actually put that tag in there and you know that colleagues will be able to search and find the resource. And the site pre-populates, so if there's something that's already in the site, it will pop up, and you can just select it. And you can also add tags that are not already in the taxonomy, and the system will save the tag, so in the future that terminology will pop up when someone puts it in. We also have the capacity for people to comment on posts. We really encourage that, give feedback to your colleagues, answer questions, share your thoughts on the resource they posted. So how you do that is you click to the post, and you simply fill out the subject and the text box, the comment box, and hit save. You can also comment on somebody else's comment. So if somebody comments on Jeffrey's post and asks a question, then you can reply to their comment. You're also able to like content, so that way you can kind of scan some of the resources and see the ones that your colleagues particularly have liked. And I think I've covered the main points. Let me go back to the slides because I had a few other things I wanted to go over there.
Yeah, let me just make a couple of points, Cynthia. One of the great features is that when you do a post, you can have multiple documents or resources to that post. So, like for example, there's a great posting there from Arizona about their congenital syphilis sort of campaign that they did. So there's examples of fact sheets, social media campaigns that they did, some billboards. And so you don't have to create a post for each document. You can upload, I've done like 10 or 15 documents for one post. So that's a really great feature. And then the other feature is we're trying to build a community. So we know that people go up there and look at the stuff and say, hey, that's great, and maybe even download it. But I think to really make this useful is we need people to sort of comment, say, hey, that's a great resource, I use it. So there's some validation to people who post to say, hey, somebody's actually using my stuff. So we are trying to create a really virtual community of interaction and comment, and there's some really great questions. So just a couple of points I wanted to make.
Thank you, Charlie. I wanted to talk a little bit about the types of collaborative activities that the site can be used for, just in a community of practice sense, because that's really what we're trying to build is a practical community that you can go in and really get useful things to improve your program and to save you time. So problem solving is one of the collaboration activities. Seeking experience, that would be using the member directory that I talked about earlier. We're using assets. Charlie spoke to the fact that you can download and rebrand some of the things that are in the community with permission of the person that posted them. Coordinating programs together, discussing new developments in the field, best practices, promising practices, finding people in the community that might have some knowledge that you need, or working together to identify gaps that you could address together through a wiki perhaps, documenting projects, and then sharing materials that you want to get out quickly to the network, and the community is one way to do that. And then finally, just wanted to talk a little bit, and Charlie's been mentioning some of these things as we've gone along, how to build a community. So number one is really think about what you have. Share what you have that could benefit your colleagues. You might have developed something that's fairly unique in the field or not many other people have developed, and putting it there really spreads the resource and allows others to benefit from the work that you've done, since we're all committed to prevention across the country. And then also ask for what you need. We had a post today where someone asked for a resource related to an outbreak including both STDs and HIV, a response plan for how to deal with outbreaks. So if you've done any of that in your state, I encourage you to go into the community and find that post and respond. Let him know what you've done. Maybe share the plan, the document, if you're able to do that. As Charlie mentioned, commenting on posts, just really letting people know that what they've shared isn't going out into a void, that you found things useful, particularly this section of a document that they've presented, or if you have suggestions about we've done it this way in my program, ask a question if it's not clear, something that someone has posted. If you know someone who has a great resource related to a question that's been posed in the community, or just something that hasn't even been addressed yet, reach out to them and ask them to share in the community. Follow community groups, as I mentioned. The email notifications really are the best way for you to know what's going on in your areas of interest. If you don't, want to read them, you can just delete them from your inbox. We're all familiar with doing that. But I really encourage you to follow your private groups and public groups just so you can keep up with what's happening. Most of us still use email as a primary mode of communication. Using the email notifications just means you don't have to go in and check the community. You're just reminded in your email box. And then, think community when you're thinking about sharing rather than using just using the traditional mode of communication like email or the phone. Think, oh, this is something that I could, rather than just emailing to this one person who asked me for it, I can actually go into the community and share it so that other people could benefit from it too. We also want you to think about extending a conversation in the community. If you've had a meeting and you've really had some good conversation but you ran out of time, you can take that into the community and continue the conversation. If you talked about particular resources in a meeting, go into the community and share them after the meeting's over so that everyone else can see them and use them. So that's pretty much my segment, so I'm going to turn it back over to Charlie to wrap things up. And we're going to have a few case studies before we do that.
So thanks, Cynthia. Again, if you have any questions, if you could just send them on the chat function. Just a couple of quick things is a good example is I think New Hampshire posted an example of their morbidity card that they revised and some data that showed that by revising the morbidity card, they will increase data collection or data completeness for a couple of new variables. And I remember myself having whenever it came time to revising our morbidity report form, it was so helpful to look at other people's what other people have done to sort of get layout ideas or key questions to ask. And so I think this is a good example where when New Hampshire posted that their morbidity report, if everybody else posted their morbidity reports, we'd have this resource up there that whenever you came time to either revising your form or maybe you're revising your data system, it would be great that we have tools up there from a number of jurisdictions so you can see all sorts of great examples. So that's a good example of sort of posting it. The other thing is that I think most of you are familiar that NCSD is what people go to either NCSD or their program consultant when they have questions like, who do you know that's doing this? And so oftentimes you'll see in our weekly email that goes out, we post those questions. Well, we're really encouraging people now to both go ahead and go to your program consultant, come to us, but also use the NPIN site because people use different channels to get their information. But I think this would be a great site if we could really build this and having this sort of the go-to place when you have a question to ask and get answered. Again, we're not to replace your program consultant or us as a TA provider, but as an additional place where we can really build robust conversations. So what I'm going to do now is kind of give you two real examples of how some people out in the field have used the site. So, prior to them coming up, this is based off of what stuff that they had already posted. I've asked them to sort of talk about some key questions, like what was the question you posted, what did you hope to learn, what information did you receive, how did you save time, and some other things. So our first presenter is Diana Gardner from the Idaho HIV, STD, and Hepatitis Program. So Diana, welcome, and you can talk about the question that you posed.
Okay, great. Thank you. First of all, I've learned so much just from being on this webinar, and I have some good ideas of some things I want to post and put out there and continue to ask. So, but the post here that I first posted on NPIN, as you can see, it's related to posting on Craigslist to advertise Idaho's local STD testing locations and services that our health departments offer, with the intent of getting Craigslist users to get in and get tested for STDs at those locations. A little bit of background, an epidemiologist approached me recently when I was visiting her health department to ask if our program could advertise for them on Craigslist because a recent cluster of syphilis cases revealed that they had met their sex partners on Craigslist through the casual encounters section. This recent string of syphilis cases are young, heterosexual males and females, which deviated from the normal risk factor of syphilis diagnoses in Idaho, which is MSM, which prompted our DIS staff to reach out to this at-risk group on Craigslist. So when this DIS worker reached out to me, posting on Craigslist was not only new territory for them at the health department, but it was also new territory for us here at the state STD prevention program. So after discussing it with my team, we decided that I should attempt to start a thread on NPIN to learn from other jurisdictions first what advice they may have so that Idaho could start off posting more effectively, more smartly. So I posted the thread and asked if other states had posted on Craigslist, and if so, what were their experiences. And what I hope to glean from my question was to learn if posting on Craigslist was even something that other states are even doing, and if so, what worked for them, what didn't work while advertising for STD services. I had previously heard rumor that posting on Craigslist wasn't very effective, so I wanted to see if I could learn why it wasn't effective for some, and then see what we could do to maybe make it effective for us. I was hoping to hear if any states had run into any approval issues from their bureau management team in getting such a request approved, because our program has to route projects like this through our management team for approval. And lastly, I was hoping to learn what language other states maybe had used in their posts. And if it had worked for them, then we would adopt that language and modify it to reach Idaho's audience without having to reinvent the wheel and save some time. And the information that I ended up receiving from those responses was very helpful. I learned tips for posting and what to avoid using in a Craigslist post, how to make posts more effective so that they stay up longer, and even examples of what language another state had used in their Craigslist posting, which we ended up using and modifying and adopting. So I can say definitely that posting my question in NPIN saved us time and effort, because we were able to pick up right where other states were at with posting on Craigslist and hit the ground running right there with their advice. So just to highlight how valuable it is when people comment on other people's threads, so that way any type of communication is shared, whether it's just hearing that other states are thinking about doing something as well, or they've done it and it didn't go smoothly, or hey, email me and we can talk more about this, or maybe they'll post a template on the site. Because really this site is only as good as we users and recipients make it out to be. If everyone just deletes all the thread post emails or removes themselves from groups and tags, then that's not doing much good for us collectively as a whole in our prevention efforts that we are doing. And yeah, just to end, that I have learned quite a lot from where other states are at around implementing and using the rapid syphilis test, from another thread that Tom will talk about shortly here, and then also from Charlie's post on gonorrhea and chlamydia counseling and partner services training materials. I mean, as working in the apps activities and that grant, a lot of what is posted here is very applicable, and very helpful to me. And so just a big thank you to NCSD for all of the networking platforms and CDC that is provided to us in STD prevention.
Thanks, Diane. First of all, you had a great question. I think it really illustrated the value of this, because I think I would really encourage all of you to go, if you haven't seen Diana's post and all of her responses. She really got a lot of really good information, and I think one of the things is when people send us stuff to NCSD and we get back to them, only the person who asked us the question sort of gets the answer. Whereas when you post to NPIN, everybody gets everybody gets to see the question as well as all the responses. People have kind of been coming to me in NCSD for the last year or so and saying, hey, hey, can you send me what somebody sent on this question related to this? And it really saves us a lot of time, as well as just you can really learn a lot. So this is, again, Dan, a great question. I really appreciate your comments, and thanks for presenting on this. So our next speaker is going to be Tom Peterman, and this is a good example where Tom originally came to me with a question and said, hey, could you post this in the NCSD Weekly? And I said, sure. But, why don't we also post it on the NPIN site, because maybe we can generate a lot of good conversations and maybe learn a lot. I think it's one of those things that I think from Cynthia's told me, has been the most popular question and response with the most number of responses of any question on NPIN. So, thanks, Tom, and then if you could kind of explain why you asked the question and what you ended up getting out of it.
Well, thanks, Charlie. I had heard a lot about the syphilis rapid tests, and someone asked me to write a paper about that. And you can get a lot of information about syphilis tests from the literature, but you can't get much information about the rapid test, and in particular, how that's being used and some of the problems that people are running into, or some of the advantages that people are identifying. So I thought it'd be a great opportunity to poll the field to see what they're doing with the rapid test and share that information with other people, because like I said, heard a lot of people talking about it, but hadn't heard much in the way of specifics as to what people were doing that was helpful. So I put out this question basically, has anyone used the test, and got a lot of responses back. But my first comment about the website was, we haven't had much instruction on choosing an avatar. I chose one that looks kind of like Peter Dropman, the editor of Emerging Infectious Diseases, but I sort of wonder if I should have worn a wife beater or maybe a tie, or maybe I should have experimented with a different gender or race or something. I don't know. So maybe someone can talk a little bit more about those avatars later. But if we go to the next slide, Charlie, it gives you a little bit of a feel for some of the responses that I got. I really heard from a lot of people, and I basically asked people to write to me, and also told them that I would try to call them and discuss in more detail and then summarize everything. So this just posts my summary of what I learned from the whole process. And it was very good to get responses from people, and encouraging to hear people, whether they were actually doing something or not. And so I guess one comment is, when you hear from people, you know what they're doing. If you don't hear from anyone, you don't know if that's because they're not doing anything or because they're doing so much that they don't have time to respond. So that's the one thing that's a little bit unsatisfactory about it, is when you ask a question and you don't hear anything, you don't know exactly how to interpret that. But I had some good conversations with Sydney from Texas about the use of the rapid test there. They've begun using it, and they had great success in STD clinics, and they're just beginning outreach, so they're not sure about outreach yet. From New York City, a really interesting thing I learned from New York City was that they're they're using it as outreach in a van, and they don't know much yet about how many advantages and disadvantages they've identified. But one thing that was interesting about New York City is they're able to access their syphilis registry online from in the van. So that gives them the ability to know if someone comes in, whether they've been tested before and what their results were. So I thought that was pretty interesting. Hadn't seen that elsewhere. So I've learned a lot from this, got a lot of good responses. I'm still following up with some of these folks to get more information, and would welcome anyone else who's got more information to send in materials. I also want to put in a plug for the NPIN site. that I've used for congenital syphilis. I was talking to Jim Mathias in Florida about their congenital syphilis increases, and told him that Melanie Taylor had posted some really good things from Arizona that are quite useful for outreach and for providing information to the community and providers. And so it's a great opportunity to borrow information or borrow materials that have been used by someone else. I think that's a really good resource for that. So that kind of sums up my experience.
Thanks, Tom. And I think another great thing about your question was there were quite a few people that said, okay, I do this. And then they said, other people would say, hey, can I get a copy of your protocol? So getting a copy of somebody's protocol can save you so much time rather than having to create everything from scratch. Another good example of why should we all recreate the wheel when a lot of us have done all this great stuff. Let's not be shy. Let's get it out there. And again, a lot. It was not only, there were a couple of places that actually requested that protocol and actually asked people to, hey, they just said they had a protocol. Could you post it? So another good example of how useful this site is. So we've got about 10 more minutes. A couple more quick things, and then we'll open it up for questions. So a quick thing is thinking about your own program. How do you think the NPIN site could be helpful to your program? Just open up the drop-down, pick a number 1 through 5. I think it's 1 through 5, and then 1 through 5, 5 being the highest priority. So just quickly fill these out, and then we'll do that and go on to a couple poll questions and go to questions. So again, the answers are up on hopefully everybody can see the poll results on the right-hand side. Networking so far is the highest, followed by collaboration. So I think, again, there's a number of great ways that, we can use this site. So I think the question we have to all of you is, again, what we're trying to create is a virtual community in real time. And for a community to work, we have to all be willing to spend a little bit of time in, taking care of the garden, watering it, fertilizing, and adding stuff, commenting. And so our question to you is, are you willing to encourage, your staff and your colleagues to use the NPIN sites? Not to put anybody on the spot, but... So what I'm hearing from everybody is, yes, we'll do this. So again, it's sort of, I don't want to preach too much, but I can't say it enough that, we have this great tool, we have this great opportunity, but it's sort of now is the time. If we don't make this thing work now, it's going to be a lot harder to go back in 4 months and try to revitalize it. Right now, it's really shown promise, and we just need everybody to buy in. This is really our first attempt to do a national training on it. We've done some specialized trainings for, the PRISM and Maven users groups. We talked a little bit at the SIGS, 3 and 4 meeting. But what we really need you to do is not only for you to get on this, but encourage your colleagues, and especially people at local health departments, because I think local health department, STD staff, and people in community-based organizations could really benefit from this. So, again, NCSD, first of all, I really want to thank our presenters. If you want to contact them later, again, these slides are going to be posted. The presentation is going to be posted. You can email them. As well as, one of the things, NCSD really collaborates with the Division of STD Prevention at CDC to get out technical assistance. And we know technical assistance is a big part of the APPS grant. So as always, we encourage you to always talk to your program consultant if you have a question. If you're not sure which program consultant to go to, contact Bruce Heath, and he'll direct you to whoever you need to. At NCSD, technical assistance is a big part of our portfolio and what we're trying to do to help our program. So, if you want programmatic help, you can go to Dana Cropper-Williams or myself. If you need policy, you can go to Lucy or Rebecca. If you have information about adolescent sexual health, you can go to Sarah Stahlberg. And somebody new to our staff, Stephen Hicks, is specializing in PrEP and special populations. So there's a number of ways you can get TA resources. So before we open up the questions, I think we always want to try to evaluate what we're doing. And so we want to know is, was this It's Your Call helpful to you? Did you learn something? Is there some information that you got that you can maybe go back and use? So if you could just answer this question real quick, and then we will send out a little bit more in-depth evaluation in the next day or so to everybody who was on the call. So it's always great to hear that, I think for most people, if not everybody, we've really met your needs. So I think what we're going to do now is I'm going to unmute the phones and allow people to ask any questions to any of the speakers, or if you had any comments about the NPIN site, you've used it and you found this hard, or you really like this. We'd really also like to know sort of like what's working for you and how we can make it better.
The conference has been unmuted.
So any questions or comments anybody wants to make?
So hi Charlie, this is Ninad. Great presentation, and as you know, we are using it to launch a couple of user groups on surveillance information system, namely PRISM and Maven. The only comment that I have is if somehow we could make the login process a little bit easier, maybe that would get more people into the website, because right now the barrier is that people think that they will click on the link, it will take them to a website where they will have to enter username and password, and people generally don't like to do that. So if that integration could be achieved, I think that would increase participation for the website.
Okay, thank you for that comment. Cynthia, do you have any response to that? Or?
Yes, and John at CDC, did you have a response to that, or you want me to take that one? John might be on mute, so I'll go ahead and if he wants to add to it, he can. Basically, we have to meet certain security requirements at CDC for a platform like this, and there is a requirement that there has to be certain privacy protections, and username and password is part of that. It's a security measure, so that there has to be a username and password, but we definitely want to look at making the process as easy as possible. If you forget your password or your username, if you need to change it because it's expired, because the system will require you to change it, that's another security protocol that we have to meet. So if you have any issues with how that's functioning, please do share it with Charlie or with me so we can bring it to JBS. My colleague Kate is on the phone from JBS, so we can talk with her about it and see what might be able to be changed to make that easier. Thank you.
Yeah, and I will also just comment that, I think depending on your firewall and your security at work or wherever you're at, for those of us who don't have a lot of problems with our computers, when I log into the site, it already has my username and password in the system sort of, and all I have to do is click, log in, and it's in there, so I don't have to type in my password. So, if your system is able to save your password and you use it like a lot of the Windows browsers or Chrome browsers or other browsers has, that would help it. But, we have heard that issue, Ninad, and we'll work on it. Other comments or questions, or, people want to, things that have really worked for them, or issues they've had, or why they think it's hard to access the site, or even find the time. We'd love to hear from people in the couple minutes remaining. So other than our case study presenters, has anybody else on the call found the site to be helpful?
So again, this is Ninad, and I would say we are finding it very helpful in terms of learning about workarounds and other things that people are posting on Maven and Prism user group sites. I think it's a great beginning, and as we go along, I think it will be very helpful in transmission of best practices and other things that are so important for people in the field.
Great.
So it would become a sort of vehicle for of ideas and sharing of best practices going forward.
Okay. Anybody else want to make a comment? So just a couple of closing remarks. So again, I think we are in this point in time where we have this really unique tool. It's not the only tool in our arsenal. We're still going to use other channels, the NCSD, weekly email, talking to your consultant. But I think, again, the SIG meetings, there's so much good stuff out there that we need. Why reinvent the wheel? Let's learn from each other. But again, if we're going to make this site work, people have to just invest a little bit of time in either uploading some of their resources, or making comments, or having asking good questions, whatever. So one other question, somebody just asked about the avatar. So Cynthia, could you sort of talk about the avatar
Sure.
issue?
Well, I spoke earlier about our security and sort of privacy level, and because of that, the level that we're at, we cannot use pictures right now. So the avatars it was a workaround. So we tried to develop a range of them so we could closely, we could approximate as many of you as possible. And we also included some logos so that people could select those. I know a number of people have selected those. And we hope to add more in the future. So like Tom said, you can select someone you admire, for your avatar if there's not one that you want to use for yourself. And occasionally our graphics person, will take a special request. So just let me know if you have one of those. But yeah, that's the situation with the avatars.
Okay. Any other final questions? We'll close out in a minute. Well, again, on behalf of NCSD, we really want to thank everybody who's participated in this webinar. We hope it's been helpful. If you do have any questions or have any ideas for future It's Your Call webinar discussions, please email me or anybody on the NCSD staff. If you have any suggestions on how we can make NPIN even better and more useful, please email Cynthia or myself or any of the group administrators on my earlier slide. We will have the slides and the presentation posted probably sometime in the next week, if not sooner. And again, just a call out to everybody is this is a great tool to use. Let's all kind of contribute and make this work for all of us. So again, I want to thank our presenters and thank everybody for being on. So have a great afternoon and talk to you next time. And
real quick, I want to thank you, Charlie, and the staff of NCSD for being such great champions of the community. So thank you from NPIN.
Thanks, Cynthia. All right. Goodbye, everybody.
Bye. Thanks, everyone.